It seemed to hit a little bit earlier this year. We are tending to see, quite a bit more symptomatic patients through the clinic. Seems to be tapering off just a little bit right now. We're really seeing a lot of predominantly flu A right now, which is kind of like that H3N2 one if you hear in the news. So that's the predominant strain that we're seeing right now. If you look at just positivity rates, we see spikes obviously in that over the age of 65 and then 0 to 4. And those tend to be the kind of the most vulnerable groups relative to these diseases. People assume flu is predominantly GI, right? Like we think of like the stomach flu. Influenza is not. It's a predominantly respiratory disease. Folks who are hit with flu feel like they're hit by a bus. I mean, they just feel lousy. It's typically rapid onset, pain in the muscles, pain in the joints, high fevers, just feeling very, very lousy. Oftentimes cough, maybe a sore throat, but cough is pretty significant, headache, things along those lines. When you're feeling lousy, it's really hard as a patient to be able to tell where and when you need to go in. I would encourage folks to call the appointment line because we have 24-hour triage nursing on that appointment line. They will walk through their symptoms and really help kind of decide, all right, is this a person who really doesn't need to be seen versus someone who can just stay at home and write it out.